The question about the impact of COVID-19 and CAR T cells is really very challenging and important question. I think the pandemic represented a huge challenge for the administration of CAR T cells, but also for performing stem cell transplantations, whether autologous or allogenic in general. And there are several reasons for this. Of course, logistical reasons, hospital beds being overwhelmed with COVID patients, but also the shortage of ICU beds in different places in different countries. In CAR T cells, I think one key challenge is about the potential risk of cytokine release syndrome and neurotoxicity, which can usually require the use of ICU beds. So this has been a challenge, and obviously it was very important to secure a few beds for these patients before embarking on this. The other issue is about the infection with the COVID-19 virus itself. And unfortunately, usually these patients are highly immunosuppressed, whether lymphoma, ALL, or myeloma patient. And many of these patients, after such a severe COVID-19 infection, would be in a bad general status and may not be fit or eligible for CAR T cells. The other issue one can face is about the discovery of COVID-19 infection immediately before CAR T cell infusion, and that would require, depending on the clinical status of the patient, to delay the infusion. But we have also experienced a situation where the infection was discovered after the infusion of these CAR T cells, and this created a lot of anxiety for the patient, but also for the healthcare professionals, because it is not easy or well established how to manage a patient receiving CAR T cells, but at the same time experiencing an infection. And obviously, it depends whether this is a symptomatic infection versus just a discovery of positive PCR. So, of course, today we do have some prophylactic antibodies that are proving to be useful. Of course, I would insist on the fact that whether candidate for CAR T cells or not, all immunosuppressed and hematology patients should be vaccinated. Of course, we know very well that not all of them will respond very well to the vaccine, but still, I think overall there is an important and significant benefit for everybody. At the end of the day, I think the COVID-19 pandemic has been really challenging when it comes to treating patients with hematological malignancies. And I think all efforts should be directed towards avoiding any loss of chance and allowing these patients to receive state-of-the-art therapy. And I believe most of the teams, if not all of them, managed to do this. And this is really great news for our patients.